Hello, and welcome to today's webinar, Accelerate Health Outcomes at Your Organization with Total Worker Health. We hope you'll learn some useful ideas, create space for reflection to apply the knowledge, and map out some initial steps for you to create a healthier and safer workforce. My name is Joel Spoonheim, and I am the Senior Director for Worksite Health and Population Wellbeing at Health Partners, where our team supports employers large and small with a range of services, including on-site clinics, leave management, and comprehensive well-being solutions. I spent the past 15 years consulting with employers large and small, government agencies, and community organizations to drive measurable health improvement in their populations. Previously, I spent 15 years working in local and federal government, shaping policy and partnerships. I am joined today by my friend and colleague, Jack Dennerlein, and will now turn it over to him.
Thanks, Joel. Hi, everyone. I'm Jack. I'm a Dean of Boston University's Sargent College of Health and Rehabilitation Sciences. I'm also a senior advisor and collaborator for the Center for Work Health and Wellbeing at the Harvard T.H. Chan School of Public Health, where I'm also an adjunct professor of ergonomics and safety. I've been affiliated with the center for nearly 2 decades now. My background is in occupational ergonomics and safety. I'm also a fellow of the Human Factors and Ergonomics Society here in the United States and have served on several advisory boards and committees for worker safety, health, and well-being, both private industrial groups as well as government agencies. I've been an active leader and contributor in the development of NIOSH's Total Worker Health program. I've published extensively on the topic with my colleagues at the center. I've also developed, designed, and implemented total worker health interventions in several industries, most notably construction, but also in healthcare, transportation, and food services. I'm a huge advocate for ensuring everyone feels welcome in the work environment. I believe the tenets of total worker health help us achieve inclusion by allowing everyone to have a voice in what impacts them at work. As part of this webinar, we've created an action planning worksheet that accompanies the content that we're covering today. We encourage you to have it available, and we will prompt you to pause the recording and start documenting your ideas around total worker health throughout the webinar. This will help you see how you can accelerate health outcomes and bring total worker health to your organization. You can download the action planning worksheet where you access this webinar recording. If needed, you can pause the video now to access the worksheet. The center has partnered with Health Partners over the past decade with the shared mission of disseminating and implementing total worker health, also referred to as TWH. Total worker health approaches are based on decades of research at the Chan School. We continue that partnership today with this webinar. The practical implications of this research are summarized in the center's guidelines. We'll be referring to the guidelines throughout the webinar, and at the end, we will provide you links to it as well. We have several objectives to cover during our 3 sessions that we're going to do today. First of all, we want to engage you with the total worker health and its approach to worker safety, health, and well-being so that you can become more familiar with the topic, but also initiate your thoughts on how to integrate total worker health into your own organization. Second, we've worked with lots of companies, and it takes a long time to do what we're asking you to do today. Your ideas that you come out of this webinar are very preliminary. We get it. If you watch the short video we created around total worker health, you'll recall hearing from St. Croix Health and their total worker health journey. Through our partnerships and guidance, they have finalized action plans to get to work on through an 18-month process. So this webinar today is comprised of 3 sessions. In each session, we will first provide an overview of the concept. We'll then have you reflect on a specific question. We have provided access to an editable PDF referenced earlier. That is a worksheet for you to complete as we go. At the end, you should have the beginnings of a plan to take back to your company. So I'm going to turn it back over to Joel, who will start our first session now.
Thanks, Jack. So in our first session, we will cover what is total worker health and its potential benefits. Then we're going to get you working on some goals. So what is total worker health? Here are the definitions from the National Institute of Occupational Safety and Health, also known as NIOSH, and they're the ones who coined the term total worker health. It is both a field of study and an approach to worker health and well-being. In its most basic form, it is the alignment of and integration of two fields, safety and wellness. Safety folks learn psychosocial elements for injury prevention. Wellness folks learn to improve the environmental factors to improve workers' health. While we'll spend most of this session digging deeper into understanding total worker health, we should quickly address the question, what are the benefits for implementing this? So work accounts for about 1/3 of environmental exposures, good and bad, for adults. We must think about the work environment if we want to make a difference, improving the health and performance of our workforce. Work safety, health, and well-being have such a direct impact on enterprise outcomes, such as absences, turnover, job satisfaction, productivity, product and service quality, organizational climate, and overall performance. Neither safety nor health strategies can reach their full desired potential if they continue to operate in silos. They are more effective when they're integrated. One example of a group that has seen remarkable success with this approach is Dartmouth Hitchcock Medical Center. And on the right side of the slide, you can see that with comprehensive policies and practices aimed at working conditions, they achieved clear, measurable results in reducing injuries and lowering costs, something they had been unable to do before using an integrated approach. With that brief recap of why this matters, I'd like to shift us into a bit of theory that informs the work. So there's compelling total worker health research, which provides evidence that the conditions of work impact health, ranging from, of course, workplace injuries all the way to non-communicable illnesses such as heart disease. We will talk a lot about working conditions or conditions of work, and there are three types of conditions. The physical environment includes the classic hazards, such as a supportive or healthy workplace design. Work organization includes job tasks, demands, and the benefits of a job. And the psychosocial environment includes the social and interpersonal interactions. This includes coworker and supervisor support, psychological safety, and discrimination. While it's beyond our scope today to identify every working condition across various organizations and industry, the lists here provide you examples of conditions that might exist at your worksite. These are the levers or the triggers in a workplace that workers are exposed to and are related in synergistic ways to the health outcomes that we're trying to prevent and mitigate. To make this more practical, I'm going to summarize a 5-page case study that you can read in the guidelines that Jack mentioned earlier. I mentioned the guidelines again to encourage you after the session to download them as an additional reference resource as you move your work forward. So let's discuss identifying root causes of back injuries by identifying working conditions related to back injuries, and we'll do this using a hospital example. In a hospital, the following working conditions can contribute to back injuries. Let's place them in the domains that we discussed before. So in the physical environment, working conditions related to back injuries could be the availability of mechanical lift equipment or slippery floors. Conditions related to the work organization include how our patients moved, the inability to take breaks, shift work that alternates, putting people at poor sleep habits, and of course, return to work policies and practices, because effective policies support both supervisors and injured employees when they're returning to work. Under the psychosocial work environment domain, the factors can include experiencing low supervisor and coworker support or outright harassment. With this initial understanding that we are going to do some root cause analysis, let's begin with the first step of the total worker health approach, which is to determine your goal and what do you want to improve. Like with any new initiative, the goal provides direction for your team. However, creating this goal, especially as we think about integrating different fields, can be easy or hard. For now, think about what brought you here to listen to this webinar. Ideas may include, does your organization want to reduce employee stress from certain job demands or long hours? Does management want to build a culture of health that leads to lower claims costs? Do you have a burning issue, like a specific pain point, like rising healthcare costs around a certain condition, or injuries, or employee turnover? The guidelines provide a specific example related to low back pain that we're going to reference several times today. So the examples here are that they wanted to reduce worker injuries, but they went further and created a SMART objective, which was to reduce worker back injuries on the hospital floor by 10% over 12 months. So SMART objectives, again, many of you know this acronym, but SMART stands for specific, measurable, achievable, relevant, and timely. And you see that reflected in this goal of reducing back injuries, where on the hospital floor, measurable by 10%, timely over 12 months, and obviously they felt it was achievable and relevant. So when it comes to worker safety, health, and well-being within your organization, please think about a single issue you want to improve or address within your organization. So to begin, take that action planning worksheet and go to page 2 and write down your first idea for an issue, goal, or objective for your organization. What worker safety, health, and well-being issue overall do you want to address? Then break it down and produce a single SMART objective. Focus on one issue or goal for today. At this moment, you may pause the video and resume once you've completed this activity.
Welcome back, everybody, from the exercise. And it's Jack again here. And thank Joel for the first session. Now we're leading into the second session. And let me starting to say, we're going to now dive into a deeper dive into the conditions of work and get you thinking about them and identifying what conditions are associated with the outcomes defined in your goal and objectives that you just wrote down as from session 1. So you've seen this slide before, and we're repeating it here because it's crucial to the total worker health approach. Now that you have the goal, the next step is to identify the key working conditions, policies, and practices that will address these goals. By targeting working conditions, you work at a systems level and focus on the root causes of health and safety issues rather than just addressing the symptoms of a problem. For example, training and other employee activities have their place. However, often training alone is not effective, especially when the resources to support the practices being taught are not provided. Think of those unfunded mandates we all have at work. So training is, however, often a necessary part of a systems and more holistic approach. Same is true with just addressing the physical components of environment. As an engineer, I think about physical stuff all the time and its importance. However, we can give workers highly adjustable furniture or ceiling lifts in the hospital, but without training and management systems that support the use of these technology, simply outfitting workers with these technologies often fail in preventing injuries. For instance, if you simply tell workers to stretch or work out to ease their back pain, it usually doesn't prevent or reduce injuries because the real causes of pain may not be addressed, and they might include moving heavy and awkward loads, obstructions in hallways or scaffolding that workers can trip over, sedentary or stationary work where employees don't move enough to get the kinks out, or an unsupportive supervisor who triggers stress, which can tighten workers' back muscles and make them more susceptible to strain. And more often than the case, it's a combination of all of these, hence, again, supporting the idea of a systems approach. Remember, working conditions vary by work site and even working groups. Think about the relational aspects of psychosocial factors and how many times you've been in a good working group or know of a good group of workers that seem to make things go really well. So, or how a certain facility has horrible air quality issues because it was built, say, in the 1960s and has not been updated, and their HVAC system is old compared to a lot of other buildings that may be on your campuses. One effective approach to identifying the conditions of work is root cause analysis of incidents and behaviors. There are many approaches and classes for root cause analyses. These include Six Sigma's 5 Whys and Fishbone root cause approaches, just to name two. Another option is to brainstorm ideas with your team to get varied organizational viewpoints on the problem. For instance, if your objective focuses on back injuries, you can brainstorm working conditions that lead to back problems. If there is good trust with workers, asking them about what is creating stress in their day-to-day lives can give you a trove of information about what's working well and not within the system. Often workers can quickly and candidly identify how their work is stressed when their work relies on performance of another group, for example, which they have no control over. Also, it's important to dig deeper and think about the different conditions of work when doing these analyses. As we said, one approach is the Six Sigma's 5 Whys. The 5 Whys allows you to dig deeper to get to the root cause of a problem. 5 is not a fixed number, but it's a good guide. With each why, you can dig deeper. Each why leaves where the previous one leaves off. So let's look at an example. Say our goal is to reduce hand injuries, as we've had identified many injuries are occurring in our facilities. We want to investigate the most recent hand injury, which we saw was a contusion or bruising of the finger. Most likely you'll do a bunch of these types of investigations over time, and then you'll pull the results. But here is an example of a single incident as an example. First of all, the first question is, why was the worker's finger injury? Well, his finger was caught between a moving pulley and the belt. Well, then you go, well, why was the finger caught between the pulley and the belt? Well, the guard on the pulley was missing. And then you can say, well, why was the guard missing? Well, a mechanic overlooked replacing it. Well, why did the mechanic overlook it? Well, there is no written equipment servicing checklist as a result, and so it's no standard operating procedure around replacing the device. Why was there no checklist? Well, there was no hazard assessment completed. Does this all make sense? This is an example of how you can dig deeper each time. Now, it's important to say the 5 Whys allow us to identify a condition work. We found out about the unguarded machine that is usually guarded. The 5 Whys can keep going though, and was to identify that there was a failure in upstream policies, programs, and policy. It can then help us create policies and programs and practices that address these conditions that impact the outcome of interest. However, we are looking at also at behaviors. In this case, why did the worker put their finger where it wasn't supposed to be? Again, we can ask the 5 Whys to investigate this behavior. Often it can be related to production pressures or fear of retaliation. This is where human factors are extremely helpful, informing us on what work environmental factors influence worker behavior. On the slide, I've given some examples, but it is unclear from this investigation of why the lady swallowed the fly. We need more information. Okay, enough said about this, and you can do and explore some of your own examples. But going back to your action planning worksheet, please go to page 3. Thinking about an issue and goal you've identified in session 1, what are the root causes you need to address to meet this goal? Use the 5 Whys technique to help you identify these. Or use a different approach. Regardless, identify the root causes as best as you can. Please try identifying at least one factor in each type of condition: physical, organization, psychosocial, or organizational. There are many physical factors or for mental health, for example, especially in highly hazardous environments. You may pause the video now and resume once you've completed activity 2.
Welcome back, and thank you, Jack, for bringing us through the second chapter, and now we'll go into session 3. This is where we're going to take action to reach the goal identified in the first session, through the conditions of work that we identified in session 2. In effect, up to now, we've been focused on making sure we know what we want to achieve and what factors are causing the currently less than desirable result. With the goal and hurdles in mind, we need a model to inform how we are going to create change. The guidelines call out 6 key characteristics of a successful total worker health approach: leadership, commitment, and engagement; participation, which means employees at all levels of an organization; policies, programs, and practices that foster supportive working conditions; comprehensive and collaborative strategies; adherence; and data-driven change. Now, for sake of time, we're only going to focus today on the third characteristic, the policies, programs, and practices that foster supportive working conditions. Upstream from the conditions of work are organizational policies, programs, and practices. To create change in the working conditions, we have to make changes upstream to the policies, programs, and practices, and we may need to create new ones. This image shows an example of what falls under each of these 3 levels, though I want to acknowledge they function on a continuum. A practice, for example, can be turned into a policy, such as a respectful, high-functioning organization adopting an anti-harassment policy to formalize the culture as new people join. Similarly, a program to train people on safe use of equipment can shape practices or team behaviors. So don't get hung up exactly on where they fall in the 3. Using this slide as an example, you can see here that the policy will include standard operating procedures, documented, what do we expect. The program is about making sure we have dedicated resources. Do we have the right number of people? Are there financials in place to motivate correctly? Is the training in place? Are there assessments being done regularly? And is there evaluation? And practice is the last. What are those normative group behaviors? Let's look at another example, and this one from a manufacturing environment. Here we have an employer where stress is high and people are rushing, which creates unsafe practices, and injuries are measurably up. So workers were stressed because they didn't have enough tools that worked. Many of the tools were broken, they were not being maintained, or they were being hoarded. As a result, the risk of injury went up because of the poor tools and the rushed schedules. So why was this? Well, the root cause analysis found that there was a lack of sufficient, well-maintained tools, which then led employees to hoard them. So what can be done? Let's take a look at the slide and do a deeper dive. First of all, on the policy front, they wanted to say that all tools were going to be registered in a tool management system, and all workers are going to be trained in that system, and there would be reporting expected when the system wasn't working. But that only works if you then invest, which is why you see the programs. In the program around resources, the company purchased a tool management system that allowed for systematic tracking as well as reporting. But that wasn't enough because you also had the resources of having the equipment maintained. And at least for an interim, if not long term, they needed a larger repair team. Ultimately, the practices, though, that needed to be expected, that new behavior was for employees to check out equipment and return it daily, and noting when maintenance was needed. The result of this is that you end up with a physical environment with safer, well-maintained tools, a work organization that manages it through a tool management system, and a psychosocial environment change of less hoarding and less resentment between workers who did hoard. Let's go back then to your action planning worksheet and go to page 4. As you've done before, you will now have time to work through 3 actions that can address each of the working condition categories: physical, organizational, and psychosocial. And as you think of these working condition categories, consider what policies, programs, and practices can be applied to achieve the outcome you're looking for. So once again, feel free to pause your video and resume once you've completed the activity. Thank you and welcome back from session 3. We hope that getting that documented moves you forward. We do know there's a lot more to learn, and you can learn more from additional case studies. There's also more tools in the guidelines, and you can get all of this through downloading the guidelines following the URL that's shown on the screen. And the guidelines are available at no cost. And with that, we want to thank you for your desire to improve the health, safety, and well-being of the people you work with. We wish you well on this journey to improve outcomes. Thank you for watching and have a wonderful day.